number of people felt that it was too much of a rush and that we wouldn't be able to pull it off, that it was too ambitious. We started thinking about bringing some 50 or 60 people around the table, and hopefully we could have an exchange and update ourselves in terms of where we are at regarding the secondary preventive benefit of antiretroviral therapy. And I must say that I have surprised myself with the fact that people were more than willing to participate, more than willing to come, and I didn't have to twist too many arms. After a given point, things started to roll out, and it has been terrific. The last couple of days, I think, have been invigorating. I agree that there are tensions, as it was discussed a minute ago, but I think it's a very healthy tension. I think that we all understand that if we optimize the therapeutic use of antiretroviral therapy, we will control morbidity and mortality. There's absolutely no doubt about that. We will stop vertical transmission of HIV, and as a very, very welcome side effect, we will see a decrease in new cases. And the evidence is, in my opinion, quite positive, quite overwhelming. And you know, we still have contradictions. I mean, I laugh to myself, no, not really, but when I hear people saying the evidence is overwhelming that we can treat serodiscordant couples, that we should be moving in that direction. We should just recommend it. I'm ready to recommend it. But then at the same time, people are in the same sentence supporting randomized clinical trials for when to start. you got to, it's either one or the other. You won't be able to do both. Because if you're going to put all the women on antiretroviral therapy because they are infected, or all the men, then I don't know where you're going to try to do this randomized trial. So I think we made a lot of progress. We need to go back and think carefully how we reconcile all of these statements, because some of the statements are not mutually compatible. And some of the trials that we want to do will not be compatible with the new sort of notion that we want to use treatment in this and that population. It is not my intention or my job to give you my biases, and besides everybody knows them anyways. That's why you're here today. But I want to tell you that if I have my way with it, I'd like to see you coming together again in a year's time, but with a slightly different tone to the meeting. You saw a lot of the work that is being either planned or done or implemented, and I think that what we need to do is make you all, us all, accountable for that work, so that in a year's time you can come and report on the progress that you have made and how that is going to inform policy and actually change policy. I think we all agree this is probably the most important thing that is happening at the present time in our field, and we have an obligation to move it forward and move it forward expeditiously. On that note, I want to once again thank my colleagues at the BC Center for Excellence who have put up with a lot of the burden to make this happen, specifically Kelly, who was terrific in organizing the meeting, Pat, who helped her. Let me say it again, you won't believe it, but she organized the whole meeting by herself, all alone, and that's remarkable because at the same time, she managed to continue to make my office function, and I don't know how she does it. Our IT team, Thin, Brian, and Mike, thank you for your help. You were excellent as always. And our communications team, who has done everything possible so that we can have a Twitter presence, a Facebook presence, all that kind of stuff that they like, and I don't understand. And so Michaela, Cora, Becky, and Graham, thank you for your help. I'd like to thank our co-hosts, of course, the IAS. It's too bad that Eli couldn't make it, but he has been 100% behind this meeting, and I want to reassure you that this subject remains a top priority for the IES, both in academic terms, research terms, scientific terms, but also as a focal point for advocacy. Similarly, our friends at the UNH, WHO, who from day one rallied behind the notion of putting this meeting together, and they helped conceiving the program and shaping the structure of the program, which I think was actually very much appreciated by everybody. A great word of thanks to NIDA. Nora was terrific in embracing the idea. You notice that NIDA has made a huge investment on seek, test, treat, and retain, and I think that the dividends of that investment will be seen and become apparent very quickly. Our co-sponsors, the Office of AIDS Research, the National Institute of Infection and Diseases in the United States at the NIH, PEPFAR, Bill and Melinda Gates, ANRS, all of them, again, were extremely supportive, and I thank you for that. The Canadian Institute of Health Research and PHAC, the Public Health Agency of Canada, and our academic partners, UBC, SFU, my own institution, Providence Healthcare, and Vancouver Coastal Health, who is also helping us terrifically to implement some of the stuff that you've been hearing about while you were here in Vancouver. And last and not least, our major industry sponsors, BMS, Gilead, Janssen, Merck, and ViiV, as well as our industry partners, Abbott, Boehringer, and Biolytical. I thank you very much. It's been terrific. We'll keep in touch. There will be materials coming out of this. As I told you, we're going to send you an email, hopefully Monday or Tuesday, with a link so that you can have access to all of the materials. As we said, we're putting together a reference list. This is not my CV, it's our reference list. And if you want to contribute to that, that would be much appreciated. WHO, and specifically Ruben and his team, have been instrumental in making that happen. We want to get an inventory of work that is relevant to the field. That's been collected. There will be a document there. It's your document. It's a live document. If you want to help us compile the data, the more we know what's happening, the more we know how we can foster collaboration and help each other. We have Kay Heath that has been actively taking notes. We're going to generate some form of a summary or report. You will see it eventually, hopefully in the not too distant future, and we will put it as sort of a summary or a one-pager a summary of the meeting that we will attempt, at least attempt, to put out there in some sort of high-profile journal so that people out there can understand that there is a movement in this area. Late last year, there was a meeting that was reported off. In fact, it was the International AIDS Day in December 1st, that I forget exactly what the title was, but the gist of it was that we cannot afford universal access and we had to go back to traditional prevention. My hope is that we all agree that there cannot be prevention without universal access, and that ultimately is my closing message. Thank you, safe trip, and we'll see you again.